The Marty and Laura Show is brought to you by Veterinary Village. With locations throughout Wisconsin, Veterinary Village is dedicated to enhancing the quality of animal and human lives, today and into the future. All right, you guys, welcome to the Marty and Laura Show. I am your host, Laura Reeves. This is my dear friend, Marty Greer. And
coincidentally,
yes. Coincidentally, the Marty and Laura Show has Laura and Marty. And we're on a tear tonight, so you guys, you never know what might just come flying here. But we have committed that we're going to talk about respiratory disease in dogs. So we're not going to talk about Marty's puppy killing baby bunnies, and we're not going to talk about various and sundry bits of our misspent youth. We are going to discuss the respiratory system in the dog.
With the rest to come later.
At some point down the road, TBD.
So stay tuned because you just never know.
You just never know when some flying bits of something could come through.
Yeah.
All right. So Marty, while we do have a lot of laughs, respiratory disease is not a laughing matter. So talk to us about it. Talk to us about what folks are going to see if their dog is having a problem with respiratory disease.
Yeah. And respiratory disease is a serious concern because it can lead to something very serious, very acutely, and you can end up in a lot of trouble in a fairly short period of time. So it needs to be taken seriously. I just want to throw in that cats, because we do need to talk about cats. When cats finally develop the point that they develop respiratory disease to the point that they are in respiratory distress, they're down to their last alveolus that they cannot inflate. So cats won't tell you they have respiratory disease until the last minute. Dogs, on the other hand, are more than happy to tell you early on. They'll have a runny nose. They'll have coughing. They'll
drama
have
queens
stuff. Well, but they're dogs, and so they'll stand over you in the bed in the middle of the night and like hack in your face and gack up something on the floor that you step on in the middle of the night. All these wonderful things. But we can see cough, we can see respiratory distress, we can hear noisy respirations. There's some symptoms that dogs tell us about fairly early on, and some are serious and some are not serious, but they still need to all be assessed because you don't always know how this is going to look 24 hours from now. It may look like just a no big deal, but actually the soft, quiet cough is more serious than the loud, hacking, gacking kind of thing that they do that sounds like kennel cough. So important that you can distinguish the difference.
Okay. So when we're talking about respiratory disease, we're talking about everything from kennel cough to pneumonia.
Yeah. So upper airway and lower airway. So upper airway is pharyngitis, kennel cough, laryngeal disease, things like that, all the way down to pneumonia, lung tumors, all the stuff that happens in the lungs or the pleural cavity. The pleural cavity being where the lungs and the heart are housed in the chest. So it can be a whole array of different things. And so we're going to kind of do a really broad overview today, and then if there's enough interest we can go into some additional details when we but I always like to do the forest before the trees, because if you don't understand the overarching concerns, then you tend to kind of get lost in the whole conversation.
Okay, so let's start with the upper airway and some of those more, they're not minor, but they're less liable to be fatal kind of things.
Unless it's LARPAR, laryngeal paralysis, and that's and BOAS, which are, so we have BOAS and LARPAR, and then we have the other stuff, which is usually something relatively minor like kennel cough, but it can be a foreign body, it can be a lot of things. So upper airway is from the back of the throat or the nose. Rhinitis is the nose. So rhino is like rhinoceros. Rhino is rhinitis. That's inflammation of the nasal passages. And then we can have tracheal disease, laryngeal disease, that kind of upper respiratory thing. And then we get down past the rib cage where it ends up to be more serious when it gets into the lungs in many cases, but not all. So if we have BOAS, if we have LARPAR, that's pretty serious too.
Okay. So we're going to see coughing, we're going to see mucus, we're going to see runny eyes. Talk to us
Runny
about the
nose.
runny nose. Yep. Talk to us about the kind of range of those and where does it go from it's like the common cold, he'll get over it, into the this needs to see a doctor.
Yeah, and it's kind of tricky. It depends a little on your breed. It depends a
Mm,
little on the symptoms.
fair.
If
Mm,
they're running a fever, we get more concerned. If
mm,
it's a brachycephalic, which are the short-faced dogs, the pugs, the Frenchies, the bulldogs, those dogs I tend to be a little bit more reactive to because they
mm,
can be a problem. And then we get the old Labradors, which are laryngeal paralysis. It's not exclusively labs, but there's definitely a propensity for labs,
mm.
especially black labs, to have laryngeal paralysis. So there's definitely some things that are going on. So I suggest that you grab some video. You all have a phone in your pocket. This thing is really not just used to make phone calls. There are still people who talk on the phone, but not everybody does. But if you've got this thing in your pocket and your dog is doing something, grab your phone slash camera, grab some video of it, and then when you get to the veterinary clinic, because dogs don't cough and kids don't cough at the doctor's office, dogs don't limp when you get to the vet. We all know that. What he was doing at home isn't what they're doing when you get there. So then you can pull out the video and say, well, this is what he's doing. And is it inspiratory? Is it when they're breathing in? Is it expiratory when they're breathing out? How loud is it? What does it look like? What are they doing? What's this associated with? Dog or cat? It doesn't really matter. Cats will have these weird coughs, and I don't want to go too far into cats, but I think we should, where they'll stick their tongue out and stick their neck out, and they'll look like a turtle, and they go, hey, hey, and it sounds like they're dying,
That's
and it's
gross.
really not serious. It's a hairball. And dogs will sometimes do those things too. The first time I worked at the emergency clinic when I was first out of school, we had a dog that came into the emergency clinic. It was in the lobby and it was making this terrible sound. And I went running out to the lobby because I'm like, this dog sounds like it's dying, and it was a reverse sneeze.
Yeah.
So again, things like reverse sneezes and hairballs, they're not serious.
Right.
But it can be difficult as an owner to distinguish that because even as a brand new veterinarian, I thought, oh my God, this sounds terrible. No, it was a reverse sneeze. So if you have a question about, is this a reverse sneeze? It's different on inspiration than expiration. It's a whole different thing. So Google video of dog reverse sneezing. And then if that's what your dog is doing, you're like, oh, cool. I pinch their nostrils, I walk away, they're fine. They do it at dog shows, they do it when they're outside, they do a lot of things. So you have to kind of use some of these tools to distinguish, is this something I need to run to the emergency clinic for or call my vet immediately for? Or is this no big deal? And in 30 seconds, they're fine. They never turn blue, they never get upset. The dog just goes a few times, and then you're good.
Okay. So in the symptomology, since we're doing symptoms, um, you said something earlier that I think is an important that we should probably pick up on, that soft cough is really more dangerous than the
Yeah.
big hacking gagging, because in my mind that is associated with a heart problem. Am I correct or am I
It
incorrect?
can be it can be a heart problem, it can be pneumonia, it can be anything that's down in the lungs
Mm,
because those are those soft, quiet coughs that sometimes you don't even pay attention to because it doesn't seem serious.
mhm.
But those are actually sometimes more serious than those loud, gacking things that happen in the middle of the night or in the afternoon when you're out running around. So important that you catch this video and you can send it to your vet if your vet will look at it. You can take it to the vet at the vet clinic appointment. So those are things, because you can't always replicate those when you get to the vet clinic,
Mhm.
that your vet can look at it and go, you're fine, it's no big deal. Or, oh yeah, we need a chest x-ray like
Go over
20
here.
minutes ago.
Yeah.
Yeah,
Right.
right now.
Now. Right.
hmm and it can be serious. So
Yeah.
it, and it, and again, you want to go to a veterinary clinic that's responsive, that can take X-rays if there's an emergency, that can jump in and do some of this stuff. And you will sometimes find that you're going to be in a situation, if you have laryngeal paralysis, LARPAR for short, if your dog is in severe respiratory distress or severe respiratory distress because of a cardiac problem, a heart problem, something along those lines, your vet may be like, out, like you need to go now. And I've had dogs come to the clinic in laryngeal paralysis or cardiac disease, And we'll say to them, okay, I can sedate your dog. I can put a tube in your dog's trachea to keep them breathing. But if I put that tube in because it's LARPAR, you may never have that tube removed until the dog goes to emergency surgery or you euthanize. And so those are really difficult conversations. So this is where, even as a brand new veterinarian, I learned this line and I kind of still use it, is not to decide, is to decide. If you go in and your dog is turning blue and it's laryngeal paralysis or it's BOAS, it's brachycephalic obstructive airway syndrome, and the only thing we can do for your dog is sedate it heavily, put in a trach tube, and ship it to the emergency clinic as fast as we possibly can, are you prepared to say, when I get there and they do their additional diagnostics, there's nothing more we can do unless you can spend $10,000, or there's nothing more we can do unless you euthanize? I want to know that before you make that decision, because that may not be what you want to decide. You may decide, you know what? I'm not going. Let her go. Let him go. It's time. And LARPAR, it happens in old dogs, typically older Labradors, 10, 12, 14 years old, hot days like we've had right now. They go out, they follow the lawnmower around, they get into trouble. You're cutting the grass and the dog is wandering up and down the yard. You may be in that kind of trouble. Or brachycephalic obstructive airway syndrome, which is most typically found in the brachycephalic dogs, the Frenchies, the Bulldogs, the Pugs, those breeds. And you may say, you know what, I can't. And that's okay. But before you make that decision, I think you need to have a really straight up, honest conversation with your vet. And this is where that relationship with a veterinarian, that you trust them and they trust you and you know each other and you can align on these decisions without hours of agonizing decision, that you look at each other and say, yeah, no, I can't, or I'm good, send me. And I've had this happen too. I had one client that called us during one of our meetings that were typically uninterruptible because that was the pact we had with the other people in the meeting. I had one of them, my staff came over and said, so-and-so's on the phone. And I grabbed the phone and I said, okay, what's the deal? And he told me, and he said, this is what it is. This is what they want to do. And I said, go to surgery now, because I knew this client. I didn't have to have a 45-minute conversation. I said to him, this is what you need. This is what you want to do. You have the money to do it. I know that this is in your best interest and his. Do it. And he lived another 2.5 years. And for a Bulldog to live to be 15 and a half,
Wow.
that's something of a miracle.
Impressive. Yeah.
So you have to have this relationship. This is where the value of the relationship with somebody that you know and you trust and vice versa is so important.
100%.
Doggett simplifies the puppy buying journey by connecting families with the perfect breed and responsible, health-verified breeders. They are the only breeder marketplace that verifies health clearances and responsible breeding practices. Through their personalized puppy matcher tool and matchmaker services, they educate and guide buyers every step of the way, ensuring a seamless process and a perfect match for their lifestyle. From initial breed consultation to introductions with top breeders, Doggett makes responsible puppy ownership easy and stress-free.
Dog breeding is more than a hobby. At its best, it's an all-consuming quest to create something lasting and beautiful in the world. We are super excited to announce that the groundbreaking series Pedigrees to Pups is now streaming live on Doggett. Dr. Marty Greer and I teamed up to offer a complete 360-degree mentoring experience. We're blending advanced reproductive science with that intuitive breeder's eye. You can stream the series today on your Doggett app. If you're unsure, visit puredogtalk.com to get connected. You can answer the call to pursue that one impossible thing. The chance to preserve, protect, and improve something that truly matters. Okay, so we've talked about the range of coughs and the different things they can be. Talk to us about diagnostics on all this.
Well, most of the time they're going to start with a chest x-ray and maybe an x-ray of the upper airway, because sometimes we'll see collapsing tracheas.
Yeah.
We'll see lung tumors, we'll see pneumonia, we'll see aspiration pneumonia, we can see lung torsions. Lung torsions are rare, but they do happen, especially in the deep-chested dogs, the sighthounds. So typically you'll see x-rays being a really important part. It may include an ultrasound of the heart, an echocardiogram if it's somebody that's good at that. And it may include blood work. It may include, we may do a CBC, what's the white blood cell count? We may do a blasto test, which is not a blood count, but it's a urine sample. So it may be a whole range of diagnostics that is required. And again, this sometimes comes down to, we take a chest x-ray. Yeah, it's fine. There's no lung tumor. There's no pneumonia. You're okay. It's kennel cough. Here's some antibiotics. Here's some cough medication. You're good. Go home. But we can see things like influenza. We can see things like blastomycosis, which we've done a whole episode on. We may see aspiration pneumonia, and certainly aspiration pneumonia happens. In cats, we'll see viral diseases. In dogs, we'll see fungal and bacterial diseases. There's a whole array of these things. A kennel cough x-ray is going to look completely normal. A collapsing trachea x-ray, you're going to see where the trachea, as it enters the chest in the back part of the throat, gets really tiny and really narrow. And these are
Happened
often
to one of my pugs. So yes, I've
Yeah.
seen it. It's really
often older small breed dogs.
Mhm.
So there's a whole range of things that this can be. And if
15-year-old
you're,
pug dog with a collapsed trachea. It was very sad.
there's not a lot of good options for some of these guys. We may take a chest x-ray and see a lung tumor and say, okay, here's the deal. But they may not die of the lung tumor. They may be able to be supported and die a year and a half later from something else. But the lung tumor was found because it was there. The scariest thing to me that we see on a chest x-ray is when there's a chest full of fluid, more common in cats than dogs, but certainly seen in dogs. I actually had a client in this week. She was in for a recheck on her dog with respiratory problems. So we'd taken some chest x-rays because her dog 15 years ago had a chest full of fluid, and sent her to the vet school. The vet school said there's nothing we can do. She came back to me, and every single day I pulled fluid out of this dog's chest so the dog could breathe. Cat's the same. And we did this for weeks. Like, my thumb was permanently bruised from pulling on the syringe to pull this out. And eventually the dog's chylothorax resolved, and the dog went on to live another 3 years.
And so what's causing that fluid in the lungs?
Well, there's a lot of reasons. It can be from a leaky thoracic duct. It can be from an infection, like a grass seed, weed on foxtail, that kind of pyothorax. It can be from trauma. It can be from blood that we can see. We can see all kinds of things. So the first thing to do, if you see that on the x-ray, is to pull out the fluid and see what the character of the fluid is. If it's chyle, it's different than if it's pus. That's different than if it's blood. So there's a whole array of different things. I remember, oh my God, I remember this case when my kids were really small. I had a dog that came to the practice, and it was breathing like a freight train. Gums were white as a sheet. I took a chest x-ray. The chest was full of fluid. I stuck a needle in there because that's what I was doing when I was at the emergency clinic. I pulled out blood. I turned around and I looked at the client instantly, and I said, "Where's the rat poison?" And she said, "There's no rat poison. Oh my God, it's under the dresser." I said, "Okay, go home and get it." She left her kid, who was like 6 years old, runs out the door, runs home, runs back. The 6-year-old is looking at me with these big eyes, and I've got a syringe of blood and this dog in front of me. And I'm like, oh my God. So we ended up pulling fluid out of the dog's chest, and I auto transfused the dog with the blood that we pulled out of his chest, put it back into his bloodstream. I didn't even know you could do that because this was literally before this was published information. I'm like, well, I don't have any dog to transfuse blood from, so this is his blood. It's his type. Let's put it back in. Put it in. The dog survived, and the woman never paid her bill.
What?
And trust me, when those things happen and you're like, okay, I just practiced freaking amazing medicine, and you had the guts to leave your kid here and then not pay your bill. I mean, she eventually came back and got the kid. It's not like I still have him. that was 30 years ago. He'd be an adult by now. Well into his adult years. He's probably got kids of his own by now. But there's just things that kind of stick with you. So there's this whole array. You can see chyle, you can see pus, you can see blood, you can see just a basic kind of fluid. And cats are different than dogs. We've talked about this before. Cats are not small dogs. So in cats, it can be serious. We can see diaphragmatic hernias. There's all these things that it can be. So it takes some additional diagnostics and sometimes from fairly advanced diagnostics to sort out exactly what's going on. So
I think I've told you the story. Maybe I haven't. My Ibethan hound had an anaerobic lung
mm,
infection
mm,
and then
those
had
are
to
bad.
be, it was really bad. Like we almost lost him. And then we had to put him on metronidazole. It was the only thing to treat it.
Because it's
And
anaerobic.
yes, and then he had to have such a long and high dose of metronidazole. He started having seizures.
Yep.
And yeah, that was rough. We got him through it and he was fine, but
Yeah.
it was
So
ugly.
here's a tidbit of information that is rarely circulated. If a dog has a metronidazole toxicity, Valium will cut the toxicity rate from 30 hours to 13 hours.
Mhm.
So, little tidbit, if God help you that your dog has to be on that much metronidazole, whether it's GI disease or something else, that it ends up with seizures. But tidbit.
That was the treatment. That was what he was
Yep.
treated with to bring
Yep.
him out of the seizures. It was,
Yep. And
and that was a rough
right.
road. But he lived another, I don't know, 10
Oh
years. I
yeah.
mean, it
Once you
just
get
didn't,
through it.
yeah,
Yeah.
it
And
was
a lung
brutal.
torsion is not common, but
Mm,
again, it's one of those sort of zebras that
mhm,
happen.
mhm,
And I remember my first year out of school because I saw a lot of interesting cases that year. I had a client that came in with a sight hound, and she was an emergency room physician, and
mm.
she'd gone home. The dog was in respiratory distress, and she didn't trust her own instincts enough to say, "Yeah, I need to go to the emergency clinic." She called her neighbor to come over and look at this dog, and they said, yeah, the
Hello.
dog's in trouble." So she came in, and yes, it was a lung torsion, lung
Mm,
lobe torsion. Again, we see it in pugs, we see it in sighthounds. I don't know
mm,
why pugs and sighthounds, that doesn't make any sense because
no.
one is round and short and round and like this, and the other one is long and tall. But somehow those are the breeds that end up with problems. So if you end up with respiratory disease and the dog isn't responding well to medication, you need to do a urine test for blasto, you need to take chest x-rays. There's some additional diagnostics that need to be done. You can't just say, well, this first antibiotic didn't work. It must be kennel cough that's resistant. We can see influenza. Influenza is a really bad disease
Mhm.
that we can vaccinate for, but many people, most people don't vaccinate for it. There's only one strain now in the US. There were two for a while. Now we're down to one. So again, these are things, if you're going to dog shows, vaccinate for influenza, vaccinate for Bordetella. There are different kinds of Bordetella vaccines. There's an intranasal, there's an oral, and there's an injectable.
Mhm.
There is a much better response to the intranasal for preventing parainfluenza, adenovirus, and Bordetella. So I had a client in the other day and they said, well, I vaccinated for Bordetella. Why do I still have kennel cough? Well, there's 27 other organisms that cause kennel cough. We only vaccinate for 3. But if you're going to dog shows, use the intranasal. You're going to get much better coverage. Don't use the injectable. Yeah, the oral's easier to give because you just have to put it in their mouth, but it doesn't protect you against parainfluenza. So these are the things you need to know as nuances to this. If your vet just says, oh, yeah, this is the easy way to give it, that may not be the best solution. You may need to see a different vet, get a different vaccine in. You may need to vaccinate for influenza. These are things that you need to know the nuances to because not many veterinarians will assume that what one size fits all,
Mhm.
and it
Mhm.
may not. And it's not that your veterinarian is bad, they're just trying to generally treat the majority of their patients, but you may be a subset of patients that goes to dog shows, goes
Mm.
to daycare, goes to the dog park, does some of these things that are important. But if your dog's not getting better and they say we need chest x-rays, we need a urine test, we need a fever of unknown origin test, we need some of these other diagnostics, you need to do them because respiratory disease is nothing to mess around with.
Right.
You only get one chance to breathe, and if your breathing gets bad, it's serious. And there's a few bad ways to die and a few not so bad ways to die. There's never a good way to die.
No good ways
But
to die, Marty.
not being able to breathe, I
Bad one. Yeah.
personally think is one of the scariest things because you're aware that you can't breathe and you know, like it's pretty scary. So please, if your dog is in trouble, get help. Sometimes they need to be on oxygen. Sometimes they need to have a chest tube. Sometimes they need just an antibiotic or a sedative. they may need to be treated for cardiac disease. There's a whole array of things that can happen. But I
Okay.
would say to you, please don't let your dog or your cat die of respiratory disease, because it is just terrible. Get blow by oxygen, get nasal tubes, do what you have to do to get a diagnosis and get a treatment for your pet, because that's a terrible way to go.
Yeah, that's like I said, I two specific instances of it is, and it was terrible. Very different ones, but still both terrible. Okay, so we've talked about some of the symptoms, cough ranging from minor to major, some of the various and sundry diagnostics. What are the general ways that we treat the various respiratory diseases? I mean, it's such a broad category, and I'm not sure that's an answerable question.
Yeah, it is. And a lot of times, if we think it's kennel cough, we'll use an antibiotic. Sometimes it's appropriate, sometimes it's not.
I was just
If
going to
we think
say, is because it's a virus if it's kennel cough.
a lot of times, well, Bordetella is bacterial.
Okay.
Coronavirus, rotavirus, some of the other viruses are viral, so an antibiotic isn't going to help unless there's a secondary bacterial infection on top of the viral, that the virus sets your dog up for a bacterial infection.
Mm-hmm.
So antibiotics may or may not be appropriate. So if your veterinarian's like, no, I don't think so, it's okay. There are cough medications that can work pretty well, but sometimes we don't want to suppress the cough. If it's the soft, quiet cough, we don't want to suppress it, because if there's junk in the lungs, coughing it up is better. But if it's that loud, dry, hacking cough, sometimes a cough suppressant like dextromethorphan, and there's a product called cough tabs. There's a number of products on the market that can be really helpful to just quiet the cough. Because kennel cough is rarely a fatal disease unless your dog keeps you up all night for a week, and then you're like,
and then you lose your patience. But I want to make sure, we need to give advice about what types of over-the-counter cough syrup you don't want to give your dog.
Right. So dextromethorphan is generally safe in dogs, but you need to talk to your veterinarian about it. Things that have dextromethorphan and Tylenol in them, things that have some of these other products in them, are not safe for dogs or cats, especially cats. Tylenol and cats. Tylenol, one dose of Tylenol will kill a cat. Yeah. Guaranteed. Heinz body anemia, the cat's dead. There's nothing you can do. So you want to speak to your veterinarian about some of these things. Make sure that you're making decisions. Benadryl can be helpful with a cough. Again, it's over the counter, but again, any OTC medication should be discussed with your veterinarian first. So it just depends. There's a product called Temarel P, which is an antihistamine and a prednisone. P stands for prednisone. Temarel is the antihistamine. Old drug. It's a combination drug, which we don't see approved much anymore, because combination drugs for FDA have to be better in synergism. So each drug has to work, plus they have to work better together. So things like Temarel P, which has been on the market for probably 50 plus years, you're not going to see a drug like that approved anymore. But sometimes Temarel P is a great drug to reach for. But again, you need to speak to your veterinarian, and prednisone can be the absolutely wrong thing to do if you have blasto, if you have pyothorax, if you have some of these things. So that's why the diagnosis before you start medication is really important. If you think it's a respiratory infection, you want to pick a good antibiotic. Doxycycline can be good for mycoplasmas. Clavamox can be good. Azithromycin can be good for cats. But not every drug should be used for every situation. So just because you have amoxicillin or Clavamox or metronidazole or Baytril or whatever
on the counter
in your yeah, well, we can't get that much anymore. But just because you have it sitting around, you open your dog cabinet up and you're like, oh, I have this from 4 years ago. Probably should talk to your veterinarian before you give 4-year-old medication, and it may be the wrong drug, even if it weren't expired. And most of the time, by 4 years ago, it's probably out of date. Don't do that.
Don't do that. Don't do that. All right. Well, I think that we've cleared the air. Everybody got the joke? She's choking on how bad a joke that was. Sorry, guys. Respiratory disease really is not a joke. And so make sure if your dog's coughing, watch it, identify it, and see your veterinarian with a video in hand.
Yep. Capture that video because it will save you money.
Awesome. That is my favorite tip. All right, Marty, will you have a great night? Try not to roast in the Wisconsin, and I am trying not to roast in the Oregon, and it's the roasting time of year. So
It's all good. I
all
love
right.
summer.
Glad you do, man.
Yeah, well, where I have winter, you don't.
I don't. There's a reason I live where I live, man. I am a temperate rainforest child. I want it to be 70 degrees all the time. Like, never above, never below. It's fantastic.
There's actually a map that was put up by a meteorologist. If you Google this, you can find it.
Mhm.
That the meteorologist put up a map where you could travel to, and you were at 70 degrees every single day where you went. So you had to pick the day you started and travel the route that they mapped out.
Fantastic.
Pretty cool.
I'm all about it. All right, you guys, with that tiny tidbit, we'll sign off for the night. Hey, friends. Did you know that the Marty and Laura Show website has a special page just for young animal lovers? Whether your child is meeting their first pet or already dreaming of becoming a veterinarian, Kids Corner is a place to explore animals through creativity, curiosity, and age-appropriate learning. Designed for young animal lovers and their families, these resources encourage empathy, responsibility, and a lifelong love of pets. Start off with a free coloring page. That's right. A new coloring page is available regularly. Download one free and check back often for new designs. And if you love that free page, take your coloring adventure further with the 10-page Color Me Pets coloring pack for just $5. Each page is filled with adorable, breed-specific dogs and fun educational prompts that spark creativity and curiosity. This pack is perfect for kids who want to explore, who want to color, and who want to discover more about pets. It encourages careful observation, fine motor skills, and an appreciation for animals, all while providing hours of fun. Plus, it's an easy, printable download, perfect for rainy days, long car rides, or creative play at home. Artwork by award-winning artist Sandy Mesmer, the Color Me Canine collection brings even more adorable pets and fun designs. Explore full coloring books available online through Sandy's shop link on our page. Visit martyandlaurashow.com/kids-corner to learn more. Thank you for joining us on the Marty and Laura Show. We're excited to bring you these unique, fun, fact-based conversations about pet health. We hope you'll join us on social. Stop by the website to sign up for an extra tip of the week for your pet. While you're at it, do us a favor, please, and leave a review wherever you find your podcasts. The Marty and Laura Show is produced by Pure Dog Talk, Inc. Sound design and editing by Premium Audio Services.